Yeah, now you started it. Good evening, everybody. I wanted to welcome you to our session for this evening, which is entitled Maintaining Mental Health. My name is Hussein. I'm Hussein Sattar. My background is that I am a physician at the University of Chicago Medical Center, and I teach at the Pritzker School of Medicine as an associate professor. I'll be one of the hosts for this evening, and we're going to be joined by a special guest, Dr. Jawad Parvez.
Assalamu alaikum. Thank you, Sheikh Hussein. It's great to be here. So I did my undergraduate education at Loyola University, and I was able to go to medical school at Midwestern University, and after that I was able to do my adult psychiatry training at Loyola.
I think, Jawad, if I recall correctly, you've also done a chief resident year at Loyola as well in psychiatry.
Yes. I was able to do a chief resident year, and in that same year I was also able to do a women's mental health fellowship, which was very beneficial and allowed me to explore further into specific issues regarding women's mental health.
Excellent. So we have a really nice program for you this evening. Before we even begin, I just wanted to highlight the title. It was purposely chosen, and in that it is Maintaining Mental Health. And I'd like to just begin by highlighting that really one of the great blessings is that among the many, many things that Allah subhanahu wa ta'ala has blessed us with, one is health in general, and two is our mental health. This is not something that we need to go out and achieve. Rather, it's something that we're actually granted and we simply need to maintain. Now, that doesn't mean that it's not going to require effort. Of course, there is going to be effort required in maintaining our mental health. But it's just something to just to start off just by highlighting that we have been blessed with our mental health. And just like our physical health, we really need to make an effort to maintain it in order to be as productive as possible.
Yep, I agree. And I think that one of the things that I would add to that is, we do need to understand that our mental health and maintaining is an active process. And understanding our mental health is a first step, and then being able to maintain that is definitely an active process which requires some effort.
Okay, so let's begin by just talking a little bit as an introduction. I come from a basic science background, so I always kind of look at things from a basic science perspective. And in the end, one thing to appreciate is that we are basically made up of cells, and we are bound by the biology of those cells. So just as an example, our cells are going to age, and we're not going to be able to stop that aging process. They will age, and eventually the entire body will age, and we will reach a point where our cells will give up on us, and that is just part and parcel of living life in this world. You come to this world, and eventually you do pass from this world. So we are bound by those cellular processes that are occurring in throughout our body. Now, one of the features of being biological creatures that are made of cells is that we actually live in an environment of stress. And that environment of stress is necessary for us to function. We need stress. Stress is part and parcel with our daily routine, and it allows us to function. So just as an example, I need to have a job. And when I have a job, it forces me to wake up in the morning. It forces me to maintain a schedule. It forces me to go to bed at night because I need to maintain a schedule. And the job is stressful, no doubt. Work is going to be stressful. But at the same time, that stress is very beneficial because it allows me to be able to maintain myself and to be able to follow a routine.
Yeah, and I think that's a great point. And I think one thing I would say to that is the converse is true as well, where you have situations where there isn't enough stress. For example, in retirement, for example, you might see this when you have time off of school or you're not engaging in a specific activity or actually some kind of obligation. Then what we see is in my clinic, I see this a lot where people are experiencing depression and other issues when there's no stress.
Yeah, in fact, I could say from a spiritual perspective, which that also is a little bit of my background, I do notice that when people don't have their routines, they tend to degenerate even if they had very lofty intentions. And so it's not uncommon for a college student, for example, to be on break and realize at the end of the break that they really were not as productive as they thought they would be. Whereas during the school year, where they have classes and a schedule, they're able to be much more productive. So again, the summary here is that some stress is needed to function. At the same time, however, we should also appreciate that we don't want too much stress. Too much stress will expose cracks and will damage us, and that could eventually lead to illness. Again, physically, I think we all can appreciate this. There's a certain amount of stress that our muscles can take, and you can put that stress on the muscles, and that's very healthy, and it keeps us healthy. But if you put a lot of stress on the muscles, for example, you have to pick up some very heavy weights, you could actually strain the muscle, or you could even further injure the muscle. So this is a physical phenomena. It's just a general principle to understand. Now, our goal in life is to create a balance so that we have enough stress that we remain productive, but at the same time, we don't have so much stress that we become injured.
Yeah, and I think just one thing I'd add exactly that most patients or most people we're dealing with are looking for a balance. And I think Sheikh Hussein just mentioned having enough on your plate, but not having too much on your plate. And I think that we always strive to achieve that balance.
So taking this one step further, let's now apply this same paradigm to emotions and emotional stress. So just like we need physical stress and a routine in order to maintain ourselves, in the same way, we do need emotional stress, and it is a necessary part of our life. Now, you might ask, why do I need to, for example, be angry on occasion, or why do I need to be sad on occasion, or why do I need to fear on occasion? And the answer is that if you're not sad, or if we're not sad, how will we ever know what it means to experience happiness? If we don't fear, how will we ever know what it means to be safe? If we don't get angry on occasion, how will we ever know, for example, in this case, from a spiritual dimension, the anger of Allah subhanahu wa ta'ala, and that it is something that we need to try to avoid? So it is important to experience certain stress in life that leads to emotions, and there's nothing wrong with that. In fact, these are essential for both our religious and our worldly experiences.
Yeah, and Sheikh Hussein mentioned these are essential. I think I would agree, and I think the other thing that you see is that there are situations where someone might actually not be able to experience emotions, and then we see in our office, for example, people come to you and say, "Well, I can't experience any emotion," and this is some certain disorders can have this in psychiatry and psychology, where emotional experience becomes muted, and they can no longer feel joy, or even they can no longer feel anger or sadness. And so they yearn for these emotions. So I think we need to look at the aspect of the fact that this is an important aspect of our having emotions and experiencing them.
Yeah, so maybe the summary, Jawad, is that there's nothing wrong with experiencing emotions.
Right.
It's part of life.
Right.
There may be a circumstance in which the emotions can get the better of us, and there we may need to make some adjustments, but we're going to talk about that a little bit later today. So let's just, to highlight this one step further, let's just give a couple examples from the Holy Quran. So the example here, the first would be concerning the Prophet sallallahu alaihi wasallam, in which Allah subhanahu wa ta'ala states concerning his emotional state regarding the da'wah that he was giving to the people of his community. And Allah states here, فَلَعَلَّكَ بَاخِعٌ نَفْسَكَ عَلَىٰ آثَارِهِمْ إِن لَّمْ يُؤْمِنُوا بِهَذَا الْحَدِيثِ أَسَفًا, which the translation is also on your screen along with the Arabic. But essentially what's being said here is Allah subhanahu wa ta'ala is commenting on the emotional state of the Prophet sallallahu alaihi wasallam concerning how badly he wanted the people around him to accept the message of Islam. And in fact, it was such an extreme desire of his that he would grieve extensively if the people wouldn't accept his message. And Allah subhanahu wa ta'ala acknowledges this by saying, perhaps you will destroy yourself with this grief. Your grief is so severe that perhaps you're going to you're getting to the point where you could destroy yourself because you're so continuously engaged in this emotion. And it's acknowledged here, and subhanAllah, it just goes to show you the deep experience of emotion that even the Prophet sallallahu alaihi wasallam experienced. Now there's an additional example which we can also take from the Quran, and that's the example of Maryam alayhi salam. And this example that I've provided here is essentially the circumstance in which she was in the process of giving birth, and in the process of giving birth, she was undergoing two major stresses. The first, of course, was the whole process of birth and the labor, and of course that's exceedingly stressful. But perhaps even more so, the whole idea that she was going to have to face her community with a child that apparently seemed to be, quote unquote, illegitimate, And how would she stand before the community and be able to explain that she had this child and convince the community that this child was a miracle? And she was so stressed by this and so worried by this that she makes a very extreme statement. And Allah subhanahu wa ta'ala actually captures that quote and preserves it until the end of time. And I have that here on the screen here. قَالَتْ يَا لَيْتَنِي مِتُّ قَبْلَ هَذَا. I wish, she says, and this is a quote, I wish that I had died before this. I wish I had died before this. وَكُنْتُ نَسْيًا مَنْسِيًّا. And I had been completely forgotten in oblivion. It's a very, very deep and powerful statement. And essentially it's showing you the extent of emotion that even the most pious within the community have experienced historically.
Yeah, and that reminds me of an example from the Sirah of our beloved Prophet alayhi salam. Talking about experiencing the extent of emotion. It comes that he's holding his son Ibrahim, who's dying and who's breathing heavily, and the Prophet alayhi salam's eyes, they fill up with tears, and the tears begin to run down his cheeks. And Abdurrahman ibn Auf radiallahu anh says to the Prophet sallallahu alaihi wasallam, "Oh, you too cry, O Prophet of Allah?" SubhanAllah. And the Prophet sallallahu alaihi wasallam replies, "This is mercy." He replies to Abdurrahman ibn Auf that this is mercy. So what this highlights is 2 points. One is that at the time of the Prophet sallallahu alaihi wasallam, expressing emotion wasn't necessarily understood by the men and women. It was not necessarily commonplace in society to express emotion. But here we have the Prophet ﷺ expressing emotion freely.
Highlighting actually that it is a part and parcel of human beings, and it's part of our deen as well.
Yeah.
And so again, what we're trying to highlight here is that we will, as human beings, now of course we're not prophets and we're not near the pious who came before us, but we will, as part of our human experience, go through emotions and difficult emotional states. But what I think we can say is that in each of these circumstances, these individuals bounced back from that emotion, were able to process that emotion, and were able to move on and do the amazing things that they continued to do throughout their lives. And this essentially is our state as well. We want to and we expect to undergo various emotional stresses and experience various emotions, but we need to maintain ourselves in the process. And so that kind of brings us to the next point.
Yeah, so basically here we're outlining what we're going to talk about in the next several slides. This is basically the way that we can maintain our mental health. And we've broken it down into 4 steps. And the first step, maintaining ourselves, we're going to discuss ways to maintain our mental health and various techniques to do so. And then number 2 is understanding ourselves. We're going to discuss some factors in our own history that we need to be aware of that could impact our mental health and what we should be aware of in terms of being able to impact us. And then number 3 is mitigate the stresses around us. That's basically essentially taking a perspective, a broad perspective, and understanding what stressors are actually real, what stressors we may be able to interpret differently. And the last step is to maintain surveillance. This is essentially going back to the first 1 to 3 steps when the time arises in case we need to use them.
Yeah, and Jawad, one thing I just want to add here, which I think is a really important principle to understand. You could replace this with how can we retain our physical health or maintain our physical health.
That's true.
And let's just say it this way. When I think about physical health and the various disease processes that arise in human beings, I see as, for the most part, human beings are granted this gift of health, and we need to make our best effort to maintain it. Now, that doesn't mean that that's always going to be perfect, and at times we will get sick, and at times we may develop various disorders and diseases. Right. However, if we're careful about maintaining our health, we're going to be much more likely to avoid some of the disorders and diseases that could potentially afflict people as they age. I've read some statistics on occasion where people say that 70% of disease is really related to lifestyle and maintenance issues. And actually today I was reading another article and they were saying up to 90%. Some people were claiming up to 90%. And what's really being said here is, look, yes, diabetes as an example is a reality that afflicts many people as they begin to age. But at the same time, there are certainly things that we can all do to maintain our health, to decrease the risk of that diabetes afflicting us. And even when a person has diabetes, there's things that they can do to help to decrease the effects of that. And here I'm more specifically talking about type 2 diabetes. But anyway, this same paradigm applies to mental health. We want to try to preserve our mental health. If we do some of these basic things that we're going to talk about now, that will really allow us to be able to maintain ourselves even in the face of emotional stresses.
Yeah, and I agree. I think a lot of time spent in the office is discussing ways to prevent the next recurrence, to prevent the next bout of illness. So that's a very good point.
Okay, so let's move on. Step one. Remember that Jawad mentioned that we're going to talk about 4 steps. So step one is maintaining ourselves. What are the different things that we can do to keep ourselves strong so that if there is a stress, we're able to bounce back quickly and we're able to handle the stress? So I think, one of the things, and by the way, these are not in any particular order, but one of the things to appreciate is that sleep, diet, and exercise play a tremendous role in allowing us to maintain ourselves. Now, of these 3, I think diet and exercise are very commonly understood in this day and age. I mean, you often hear people talking about the importance of a good diet, of a healthy diet, of a wholesome diet. You also hear people talking about the importance of maintaining some regimen of exercise. But sleep is something that I think is very misunderstood, particularly in this day and age, but in general. And that is that sleep appears to be a passive process in which, quote unquote, we're wasting time. What's really happening when I sleep? I'm not efficient when I sleep. I'm not getting things done. But the reality is that sleep is a very active process. When a person's sleeping, there's a whole bunch of reactions that are occurring inside the mind, inside the body as a whole. And it's allowing the person to be able to reset so that they can, you can say, delete the effects of the day before and rejuvenate and re-energize themselves for the different things that are going to arise the next day. And I really want to, out of all these 3, on this first line, really emphasize the issue of sleep.
Yeah, and I totally agree. And I find myself spending a lot of time in clinic talking about sleep. And honestly, sleep is the foundation for good health, and it actually prevents issues with mood. It prevents issues with anxiety and concentration and many other things that we deal with. I think I always talk about sleep because it is literally the foundation.
Yeah, and by the way, I mean the Quran itself mentions that sleep is a beneficial act. For example, the famous ayah وَجَعَلْنَا نَوْمَكُمْ سُبَاتًا. Allah subhanahu wa ta'ala mentions that, and we made your sleep as a repose or a rest or a recharge. And again, getting down to this very important principle that there is a blessing in sleep, that there is a benefit to sleep. One of the common things that people, sleep, honestly, we could have a separate hour lecture on sleep, and we've actually done an hour lecture on sleep. If you go to the Sacred Learning website, we have a classroom called Sunnah and Wellness, and in there, in that classroom, there is a separate talk on sleep. You might want to review that if you get time later on. But what I will say is that what's the right amount of sleep? As much as your body needs, as much as you feel that you need. Now, it should never be that your sleep is taking you away from core activities, such as making your prayer on time or engaging in important events with your family, picking up the kids from their activities or school, etc. So it shouldn't be that we're sleeping through those events. But aside from that, the amount of sleep that we need is the amount of sleep that we need. Everybody's different. Everybody needs a different amount. And, there's some obvious recommendations that various agencies make. But generally speaking, sleep is a key feature of maintaining health in general and mental health in particular. So moving on to the next line, we have an emphasis here on prayer, dhikr, and dua. I mean, no doubt that, once we maintain ourselves, then the next thing is that we need to maintain our spirits and our souls, and that is going to occur through prayer, dhikr, and dua. It's a beautiful aspect of our deen that these things are already built into our routine. I think it's important to give prayer its due. So ensure that we make a proper wudu, ensure that we create the space, both physically and mentally, to be able to get the maximum benefit out of the 5 prayers that we make. On occasion, try to spend a little bit of time during the day making dhikr. And make dua to Allah and recognize the importance of turning to Him at those times when it may seem like there is no other place that we can turn.
Yeah, and I agree. I think it goes without saying. I think one of the things that prayer, dhikr, and dua does for us is also aligns us with our spiritual side. And we understand it as a physical body and a soul. And I think that maintaining our spirituality is something that will definitely help our mental health. And I've seen that many times in clinic.
Yeah, and people will ask, what dhikr should I make? And we have a daily routine that I just usually recommend. You can always get that from us if you like, but some routine. It's just important for everyone to have some routine. I'm not saying that there's one in particular that anyone has to have, but it's better not to be random about these types of things and just wake up and say, well, I think I'll do A, B, or C. It's nice to have a little bit of regimen in life. And if you say, I'm going to make some istighfar, some salawat, I'm going to spend some time with the Quran, I might do some dhikr of the name of Allah. If you just have some sort of routine for yourself, I think that will allow you to sort of check this box off and really create a strong backbone of spirituality that will help to preserve mental health. Moving forward, the next on our list is family and friends. Very, very important. There's a certain happiness that arises in the soul and in the heart when a person is with their family and with close friends. And that is something that is highly beneficial. It helps to, again, maintain our core and will be a source of strength in order to preserve one's mental health. I think studies, Jawad, you might be able to speak a little bit about this more, but there are studies that show that when you isolate individuals and keep them away from family and friends, they certainly become more likely to have physical illness and mental illness as well.
Yeah, absolutely. And I think one thing I would say is that there is definitely, we look to find supports for people. People who are struggling, if they don't have enough support around them, we see that they can clinically deteriorate. So we do, one or two strong support figures, even one or two, can help you, pick you up in times of difficulty. And another thing that friends and family can do is help model for you how good maintenance is done. You'll see people around you who are engaged in good habits, and you can also model after them. But yes, going back to that first point, I think having people around you is extremely essential and helps lift you up in times of difficulty.
Maybe I'll just add here that, I know that it's commonplace to sort of engage friends and family from afar because of the social media platforms that we have available today. And there's nothing wrong with that. But I'd like to, in addition, just emphasize the notion that it is important to have physical interactions. Those are going to be important. And so as much as possible, we do also want to have those types of physical interactions. They do have a very positive effect on a person. Now, moving forward on this list, hobbies and activities. Often, particularly people who are religiously inclined, think that hobbies and activities could, quote unquote, potentially be a waste of time. But I would argue that hobbies and activities are important because they help to maintain yourself and allowing you to be more productive over a much longer period of time. Now, remember that life is not a sprint, it's a marathon. We need to maintain our health throughout this marathon in order to be able to achieve productivity across a very, very long period of time, ideally decades. And so hobbies and activities, I'm not saying that a person is encouraged to spend hours and hours and hours every day on their hobbies and activities such that they don't take care of their other responsibilities. But once in a while, to have a few things that a person enjoys that are within the bounds of our deen can be highly beneficial and can be very stress relieving. Again, both helping to support mental health.
Yeah, absolutely. And I think one thing I would add to that too is that we've seen from many studies that having hobbies that you can escape into does basically provide a form of stress reduction, and it reduces stress to a measurable amount. And so engaging in hobbies is very important. I think the second point I'd add to that is that to develop a hobby sometimes takes some time. You have to kind of explore your interest, and you have to put some active energy into finding things that you actually can achieve stress reduction in.
Moving on to nature, what I'll say here is that one of the important aspects of a human being is that we exist in a natural environment that surrounds us. And this natural environment is amazing from numerous different dimensions. And when a person spends time in nature, they begin to appreciate the grandness of their surroundings, which of course ties into the creator of that grandness. And they begin to appreciate their own reality in the context of that. Additionally, when they spend time in nature, there's numerous sounds, sights, colors, textures, etc. And all of these have an enormous effect on a human being, and allow a person to be able to reduce their stress, enjoy things more, etc. There's been numerous studies concerning the beneficial effects of nature. And so one of the things that is recommended, both from the Sunnah and from the science perspectives, is to take some time out and just enjoy the surroundings. Walk through a forest, even just walk, on the sidewalk, in the park, etc. Can be very beneficial, even if done for just a short period of time.
Yeah, and I think what you also can do in nature is, I think, number one, the environment, the experience of being in nature. One thing you can do is just set yourself a goal. Set yourself a goal to do a hike and achieve that goal. And in that, you basically have a mastery task, and you've mastered a task, you mastered a goal, you've reached that goal, and you spent time in nature and benefiting from it, just the way Sheikh Hussein mentioned.
And the last on our list here to maintaining ourselves is to just try to keep a general simplicity about oneself. We're human beings, and we can only, again, carry a certain amount of stress. And it's if we have a very complicated life, it tends to create a lot of weakness in our shield and really creates weakness in our core. When we say simplicity here, we mean very broadly. So what that means is simplicity in the amount of things that we have, because everything that we own is something that we have to maintain in the end. Simplicity in our finances. The more complex our transactions, the more difficult it is to be able to manage them. Simplicity in the way in which we relate with one another. You got all these complex relationships where people are fighting with one another and others, and it makes life very, very difficult, and will create just stress upon stress. And so very important, simplicity in every domain. And this is something that's established by the Sunnah. No more beautiful example present than in the Sunnah. And now you see the world talking about the importance of keeping everything simple, from even our closets. People will spend hours and hours reading about how to keep their closets simple. So very beneficial to maintaining oneself. And by doing this, by creating this simplicity, we create the space necessary to be able to take hits throughout life.
Yeah, and I think simplicity, even in our environment, we know that there's studies that show that the more stimuli that are in your environment, the more things that are around you, there's more potential for triggering anxiety. So we always recommend to have less in your environment. And decluttering is a buzzword that's thrown around nowadays. But decluttering our environment and keeping it simple allows us to experience less anxiety.
Yeah, and I've vividly recall speaking with a designer a few months back. Maybe now it's been more than a few months, and they mentioned to me less is more. And essentially what they were trying to highlight is that you don't want to put too many things in any one space, because it's not going to create the effect you're trying to achieve. Instead, it's going to create chaos and confusion. Mm-hmm. And I think that's also why we really enjoy coming to an open prayer space. There's not really much there, and that's one of the beauties of our deen. We don't have anything in the prayer space aside from the rows that we pray on. It's a big open space, and when we come into it, we feel grand, and we feel like we can achieve a lot, and we feel uplifted. And it's the simplicity. Part of it is the simplicity. Now, of course, there's a special spiritual benefit as well, but part of it is the simplicity.
Yeah, and the last thing I think I'll add is this idea of mindfulness. Anxiety is the mind going into the future and imagining the worst. So mindfulness, in a nutshell, is being able to be in the present. And so I think that's another aspect of maintaining ourselves.
Now, each of these points could actually be established, through Hadith and Quran, by the way. It wouldn't be too difficult, but it would make it for a very lengthy discussion, so I'm not going to go into that. But just to give you an example, for example, the importance of dhikr in Quran. And we know, just from this ayah, which is on the screen, it's a portion of an ayah actually, أَلَا بِذِكْرِ اللَّهِ تَطْمَئِنُّ الْقُلُوبُ, that surely it's with the remembrance of Allah that the hearts find peace. And here the remembrance of Allah could be doing the dhikr of Allah. It could also be recitation of the Quran. There is just a tremendous, tremendous power in spending time with either the Quran or in the dhikr of Allah or both. And there's a lot of peace to be gained from that. And likewise, we could go through each of the points that we made and present ayat and ahadith to establish them. We don't have the luxury of that time in this particular gathering, but just as a general principle, that's just we gave one example here.
Okay, so now we're at step 2, understanding ourselves. So step 1 is maintaining ourselves. And now here at step 2, I think one thing that we talk about, the overall picture here, is that our history and our circumstance is relevant. And we should understand that things about our past are important. And if we can understand them about ourselves, then we might be able to deal with our mental health struggles later on. So for example, if we know someone in our family has a history of depression, then it's possible that we might be more likely to develop depression. And there might be a high probability of recurrence. So an example is once you're an asthmatic, you're always an asthmatic, and you have to understand that going forward in life, you have to deal with your asthma. So it's possible that in your family, if there is depression, it may resurface in yourself. Another example of personal history and circumstance, what we mean by this is we should understand what our stress tolerance is. For example, are we taking on too many extracurricular activities if we're in school? Or are we taking on too much at work and while we're raising a family? So understanding what our stress tolerance level is will allow us to not take on too much where that might be unhealthy for us. Another example of our personal history is just our physical health. For example, if you have diabetes or high blood pressure, we know that diabetes and high blood pressure can lead to mental health illnesses down the road, especially if they're not managed. So we should know about our medical history and be able to deal with it and treat it so that it doesn't result in mental health issues. And lastly, in our personal history and circumstance, previous trauma, things that we've gone through in the past that may still be lingering today, we should be understanding what those are, and maybe if we need to address them, we can address them. The last point here is external feedback. So this is just an example. If a family member tells you or notices that you look more down, then we have to take in that information and act on it. So external feedback can come from our spouse, our parents, our friends, our local imam. But anytime someone tells us that, hey, something is not right, or something doesn't look well with you, or you're not acting the same as you normally do, then I think we need to take that information and act on it.
And Jawad, I'll just add, now I'm speaking from, my other hat, which is the role that I play in the community spiritually. For me, when I'm advising people spiritually about how to develop themselves and what would be the appropriate routine for them, it is a very personalized approach. And part of that personalized approach is informed by their own personal history. What things, for example, if they were involved in, let's say, activity X and it led to certain stressors that revealed certain weaknesses in them, we're going to be more careful about not overdoing that activity, even though it might be good for the next person. Similarly, if I know that there's a family history of, let's say, mental health illness, I might be a little more careful about making sure, even to the extent of how much Quran a person reads. You need to, these things are all important, and they need to be understood in the context of each individual. So yes, really, really important to understand ourselves. The third step in the process of maintaining health is to mitigate stressors. Now, what we're trying to highlight here is that, look, after you strengthen yourself, and after you gain an understanding of yourself and what your strengths and weaknesses are, it's still going to be important to mitigate the stressors and to control, to the best of your ability, your stressors. Now, that's not going to be always easy to do because those stressors are not in control. A lot of times we just don't have control over the stressors. But we can do some things that will help us to mitigate some of the stressors, and we want to take maximum advantage of that. So the first point I want to make here is that under mitigating stressors, it's really important to keep things in perspective. Really important to keep things in perspective. Now, What's that perspective? So let me just start by saying um, we are believers. And as believers, every one of our affairs is blessed. Now, these two things, being a believer whose every affair is blessed, are both enormous. They're both enormous because, look, the reality is that Allah has made us trillionaires. Now, I just used the word trillionaire to establish the concept. In fact, we're greater than trillionaires if you really look at it. But Allah has made us trillionaires by blessing us to be able to take His name, to be able to state the Shahada, to be able to appreciate His oneness and His magnificence, His mercy, His greatness. It's such a blessing. You have to remember that we are 1,400 years removed from the time of the Messenger. And our pious predecessors made dua to not even see this time that we live in because they were so afraid of what would occur when people were distanced in time and space from the core of our deen, which Mecca and Medina, you could say. But this is the reality that we find ourselves in. In this difficult time, Allah has blessed us with the sense to appreciate that there is no God but Allah. And that makes us billionaires or trillionaires or whatever number you want to put on it, whatever name you want to give to it. So we should always see that in the context of everything else. Now imagine if you had $1 trillion and somebody comes and takes away 2, who cares? I mean, you have to see it from now. You could see it and say, "Oh my God, somebody took $2," or you could or you could look at it the other way and say, "I have $1 trillion. What is 2? Who cares?" And that's perspective. To appreciate that I've already been given everything, and anything else that occurs is so minor in the context of this one blessing that I need to just be content and happy and appreciate this very, very special state that I've been granted. So that's one angle of perspective, and that's what I meant by saying a believer. Now, not only that, but the other thing to appreciate is that even when the little things happen, which human beings have a nature to blow up and make big, I get it, but even when the little things happen, they are always for the benefit of the believer. Even when the little things happen, they are always for the benefit of the believer. So for example, just to highlight this, the Prophet ﷺ said, "Amazing is the affair of the believer." Amazing is the affair of the believer. Ajaban li amril mu'min. That's the wording. Wondrous. We could even say wondrous is the affair of the believer. Why? Because all of it's positive. Because all of it is positive. And that's only for the believer. And then the Prophet ﷺ, he continued and he gave a very clear statement about what type of perspective we should have in the context of being believers whom Allah subhanahu wa ta'ala only desires positive for. And that is, if something good happens, something joyful occurs, then the believer thanks. And that's great for them. They get a reward. And if something harmful happens or something difficult or bad happens, they remain patient. And even in the face of that patience, it's still good for them. That's amazing. Meaning there can never be a difficulty or even a blessing. There's nothing bad or good that could ever occur except that it's positive for the believer. So this places us in perspective. Now look at the perspective. It's coming from so many different dimensions. Dimension A, we're believers. Amazing, enormous. And then dimension B, because we're believers, everything that happens is positive in our account. If it's good, we give thanks. If it's a difficulty, we remain patient and we receive a reward for that as well. So basically, everything is positive. Okay, so hopefully that helps to set some idea of perspective. And honestly, we could talk for an hour on perspective, but we've summarized it. Now, additionally, in this step 3 of mitigating stressors, I want to also highlight that another important feature of mitigating stressors is what I call maintaining an orbit. Now, again, you have to kind of go along with me a little bit to understand what we're trying to say here. But if you look at the screen, what I put here is just a little picture of the Earth in relation to the sun, and you can appreciate that the sun and the Earth is just in the right place in relation to the sun. Meaning, if the Earth was closer to the sun, it would be too hot, and if the Earth was further from the sun, it would be too cold. And you see that the Earth moves in this perfect orbit, which allows it to be able to be and remain in this perfect harmony. And so we're the same way. Of course, we're not rotating around the sun, but we're engaging with people all the time. And we need to appreciate where do we place them in our lives. Now, there might be somebody who I'm not able to get along with as well. And so I'll have to place them in the proper orbit. And there might be someone who I want to spend a little bit more time with, and they benefit me, and I might get a little closer to them. Now, of course, our Deen teaches us the extremes of the orbit. We can't say, well, in the effort to maintain my orbit, I'm never going to speak with my parents again. That's not acceptable, because our Deen teaches us how we have to deal with our parents. But even in the face of dealing with parents, there is some room to maneuver and to understand what's a positive way to engage someone so that I benefit them and they benefit me, while at the same time avoiding the clashes that might occur. What comes to mind here particularly is some of the advice that I've read from our scholars concerning going for Hajj. And one of the interesting things that they state concerning Hajj is that you shouldn't necessarily travel with just anyone. And they even give a warning about traveling with family members that are very close, because there's going to be stress at Hajj. And if during that stress, things are said that could damage a relationship, that could lead to problems downstream and make things difficult for a person. And so it's interesting that even in the context of such a righteous act of worship, there's a strong emphasis on understanding who to go with and making very calculated decisions about how to engage others.
Yeah, and I think also to bring this back to the clinical side of it as well, I 100% agree, because we place a really high premium on who the person spends time with, what energy is around them. Was it negative energy? Is it positive energy? And that has a direct impact on your mental health. So being aware of who is benefiting you, who isn't benefiting you, is very beneficial. And I agree with Sheikh Hussein, what he said.
Okay. So moving on to the next step, which is step 4, surveillance. I think maybe, Jawad, you do a lot with this. I'm going to hand this one over to you.
Yeah, so essentially this is being able to watch over ourselves, right, and pay attention to what's happening in our lives. So what I always recommend is for people to always be on guard, right, to be aware of the stimulus that you're experiencing and what's around you. So we talked about being aware, but then we always have sometimes when there's an injury that's occurring, when we feel like we're not doing as well, and there's something that's not going well in our life, or there's an influence that's affecting us, we have to make adjustments. And so we go back to steps 1 through 3. We talked about maintaining ourselves, understanding ourselves, and mitigating stressors. So when there's a situation that occurs where you feel there might be an influence that's affecting your health and your emotions, it's time to go back and reevaluate from steps 1 to 3.
Yeah, and just perhaps, just to highlight that, why don't we go back to the Sunnah, and here look at what we have on the screen, just an idea of surveillance and what happens when a stress arises. Here in this particular narration, Anas radiallahu an is narrating that when a matter distressed the Prophet sallallahu alaihi wasallam, he would supplicate. And in fact, he even in this narration from Tirmidhi, we even learn that this supplication was Ya Hayyu Ya Qayyum Birahmatika Astaghith. O living, O eternal, I seek help in your grace. And this is a very interesting example from the Sirah, or the Sunnah, you could say. Because first of all, Anas radiallahu an was the personal assistant of the Prophet sallallahu alaihi wasallam, and really got a deep look into the life of the Prophet sallallahu alaihi wasallam when he was away from the people. So that's number one. Number two, Anas was relatively young when he played this role. You're talking about maybe in his teenage years, and so for him to appreciate, number one, that the Prophet ﷺ was getting distressed, and number two, that a certain recitation would be made, is a really important point. And what we learn from this is here the Prophet ﷺ is observing himself and recognizing that there is this matter that's stressful. And as soon as it's appreciated, he's going back to the core, which is, this, we talked about dhikr and dua as a core feature of maintaining ourselves. And so here this very beautiful statement is made, Ya Hayyu Ya Qayyum, O living and eternal, Bi Rahmatika Astaghith, I seek help in your grace. And one, we should appreciate what's occurring here. But two, anytime any of us feel that we're being distressed by a matter, this would be a wonderful thing to recite as a dhikr, for example.
Yeah, and it always strikes me when you read the seerah and read about the Prophet ﷺ, how open he was in expressing his emotion and how public he made it. And it always strikes me as very, very fascinating and honestly something we can work towards.
Okay, now we've spent a significant amount of time talking about how to maintain ourselves, how to mitigate stressors, understanding ourselves, etc. And like I said earlier, my personal experience and what I read is that if a person is able to do the steps that we've highlighted, it will really keep them healthy and hopefully allow them to avoid a large percentage of mental health issues that could arise. Now, again, that doesn't mean that emotions won't exist, but it means that they'll be able to manage them, they'll be able to bounce back, and they'll be able to return back to their routines, even in the face of difficulties. However, it is possible, just like it is possible with the body under certain circumstances to exhibit illness, it's also possible to have mental illness and mental injury. And I think, Jawad, you're obviously the expert here on this, so I'm going to hand this one over to you as well.
Yeah, so basically what is mental injury, right? We talked about the normal emotional states that we described earlier. They begin to linger and then they begin to affect our routine. So that's when we should return back to our maintenance steps, like Shiksan just said. But sometimes we might need to be able to seek additional assistance if needed if that lingers further. And an example here, for example, I may not be performing my necessary task at work, or I might be experiencing some disruption in my relationships. So this could be a sign that the lingering emotional state is affecting my routine. And what we try to do is to evaluate people in the clinic and say, well, is this emotional state now lingering to the point where you are now affecting your routine and you're now affecting your relationships? So we talk about, what resources are available to us. And there are work resources, a lot of times in work and school, you'll have counselors and other therapists who are set up to help you. So we do encourage people to use those resources, and especially if you feel like the emotional state's lingering and what we just talked about, how it might be affecting your routine. The primary care physician can also play a role in evaluating you, and most primary care doctors are able to assist you if you start to notice that you're starting to go off kilter. They can at least evaluate you and help you out. Now, beyond that, you might need to see a counselor or a therapist, and at times a psychiatrist might also be involved, depending on if the situation arises to a need where medications might be needed. Now, there are Muslim care options, for example, Khalil Center. However, these are very limited, and this brings me to a point where I want to highlight that, our Muslim resources are there, but they're usually quite limited and takes a while to get in sometimes. So the point here is that a therapist does not have to be a Muslim. And I think we're going to touch on this right now because a lot of times the most qualified person to treat your disease or illness may not be a Muslim. And for example, if you have OCD or you have another kind of disease, like for example, cancer, you might need to seek out a specific specialist, and that person may not be Muslim. And most therapists are trained to understand our cultural background and our issues, so they're more than equipped to help us.
Yeah, and Jawad, maybe what I'll add here is that, look, this list of professional resources, this is a list that we should recognize provides an additional layer of support when we feel that we need it. It never hurts to take advantage of any additional layer of support. The worst thing is that you could try to use the resource and they tell you you don't seem to need to use the resource and you're safe there. But it's important to know that I can work through these things in my life, but if I find myself in a place that I'm not able to handle the issue, or I find my loved ones in a place where they're not able to handle the issue, that there are additional opportunities for support. They are very professional. They have tremendous experience in dealing with these types of issues. And some of the examples are listed on the screen here. So there's nothing wrong when when a person sees their primary care physician to say, well, I've also noticed that I've been feeling down and I'm not able to enjoy the things that I normally enjoy. And the primary care physician will be able to give advice. If you feel more comfortable with a Muslim to speak about these things, sure, of course, it's wonderful and that's available. but you don't necessarily have to, see a Muslim. You can see anyone, and there are very, very qualified people out there that can help.
Yeah, I would agree. So we talked about the various resources that are available. So I just want to highlight some of the benefits of a therapist, and just very briefly. So the overall picture here is that there are many things a therapist does, and I think the reason we included this is because we want people to understand what goes on in a therapist's office, because a lot of times it's nebulous and people don't understand what is actually happening. So they can help you improve your self-maintenance. We talked about there are times where we may not be able to identify our own stressors. We may not be able to appreciate them. For example, we may not realize that we're not sleeping enough. So a therapist will help identify some of the things that are in your life that we may ourselves not appreciate. They can help you develop coping skills. They might point out to us that you're not spending enough time engaging in your hobbies, or you're not spending enough time engaging in mindfulness. They can also identify some maybe thinking patterns that are unhealthy. For example, if you get into an accident in a red car as a child, you view all red cars as dangerous as an adult. So what a therapist can do is help you unsee that association. They can also help you work through previous trauma. We talked about before that our emotional and physical trauma that we may have experienced when we were younger can affect us in the present. So they can help you work through that, thereby helping you to be more healthy in the present. And they can help you develop emotional intelligence. This is basically what this is saying is they can help us communicate our emotions in a more effective way. So, for example, we might show anger, but what we're really feeling inside is abandonment. So a therapist helps us unlock that underlying emotion of abandonment, for example. And lastly, just want to say that all these resources we just talked about, all the skills that a therapist has, can be utilized not only by yourself, but by your family and if you're in a relationship.
Yeah, and Jawad, maybe I'll just add a couple points here. I noticed that you put a little diagram here about find a therapist near you. And this is a website. I assume that people can go to this website, and it's one way by which a therapist can be identified.
Yeah, absolutely. And I wanted to keep it as simple as possible, and it really is that simple. Just go to findthetherapist.com, type in your zip code, and you can get a picture and a profile of what the therapist's interests are, and therefore you can try to find someone that you feel might relate to you. It's very simple and a very highly utilized resource. I recommend it all the time.
Okay, wonderful. I'll kind of make 2 points here, just from my own personal experience. Of course, it's not from the clinical side, but it's from the community side. One is that I'll say that many times we recognize the need for a therapist-like person in our life, but we try to use someone who may not necessarily be qualified to be able to do that.
Absolutely.
I think the most common example that I see is when the imam or the sheikh is sort of put in the role of a therapist. And I can tell you that personally, being in the role of a sheikh in the community, as far as trying to work with people to spiritually develop themselves, when these types of issues come up, I'm the first one to say, look, I'm not a qualified therapist. I can give you advice. I can give you some basic routine that will help you to be able to maintain yourself. But when you get to the point where a therapist is needed, most imams, sheikhs, scholars, etc., they are not trained therapists. Now, there might be some that are, and those would be excellent resources to avail yourself of. But I just want to make very clear that this is a professional individual who has spent a significant amount of time and energy training. Is that something you would agree with, Jawad?
Yeah. I mean, no, of course. And I think, and the way that I would frame it is, your local imam has a certain skill set, and they can offer you that skill set. But there is a point at which that skill set is no longer able to help you in your specific problem. So it's very important to seek out a trained therapist, and I do agree with that.
And the other point that I'll make is that it is also important in life for there to be compatibility. This comes up a lot when you're looking for a teacher or an imam or a sheikh that you can work with to improve yourself in your religion. You really want someone that's compatible with you, that's going to be able to relate to you, understand your circumstances, and advise you accordingly. And I think the same would be applicable for a therapist. And so findatherapist.com sounds so easy, but what it really is doing is providing you options. You can then review, study, ask around, and eventually, hopefully, you'll be able to find someone that matches your personality. And my understanding in dealing with others who have gone through this process is that Sometimes they might try out one or two or three different
Yeah. Oh,
therapists
yeah,
until
absolutely.
they eventually find someone that they really kind of click with. Is that
Yeah,
true?
definitely. Sometimes it takes a couple tries. Sometimes the first therapist might not click, and that's why what's beneficial with this resource is that the therapist highlights what their skill set is already. They put it up front for you, and you can see if you can relate to that. So we talked about benefits of a therapist. Now here we're just talking about the benefits of a psychiatrist, and there will be times when a psychiatrist will be involved and may need to be involved. So, for example, it may be that your depression is arising due to a thyroid issue, a thyroid condition in your body. So a psychiatrist can help identify and exclude other causes of illness, and that's extremely important sometimes because it's not just the emotional state that's affecting us. Maybe a physical condition in the body that's affecting us as well. They can of course prescribe medications, and this last point is just basically that the overall treatment plan can be managed by the psychiatrist. So what this is basically saying is sometimes you'll have a therapist involved, sometimes you'll have a psychiatrist, sometimes you might have a group therapist. And so in order to manage all of these things, you kind of need to have one person who serves as the head of the treatment team. And that's what this is saying. The treatment plan can be determined by the psychiatrist, and they can help guide you as to what you need and when. And there's one last point here. If inpatient treatment is necessary, then a psychiatrist can help guide you towards that.
Okay, so let me summarize where we're at because we're going to shift gears now. So essentially, what we've kind of gotten to is the idea that we're not going to be able to avoid stress in life, that we're going to need to learn how to mitigate those stresses, and stress is a good thing, but we just don't want to get injured in the process. And in order to be able to preserve ourselves across this long journey called life, we do need to maintain ourselves. We do need to understand our particular aspects about ourselves, and we also need to mitigate our stressors. Sometimes we will get into a position where it may be that our emotional state and stress is taking us out of our routine, where it's not allowing us to be able to deal with everyday life appropriately. In which case, there are additional resources such as therapists, psychiatrists, and the others that we've listed. And these are things that we also recommend people avail themselves of, or opportunities that they avail themselves of, in order to get themselves back to the best state of mental health that they can. So I think we've pretty much covered. This was supposed to be a 1 hour long program, and we've pretty much covered sort of these core topics over that hour. And now I've just summarized that for you. One thing that we thought would be beneficial, particularly this is coming from Jawad given his background, is to maybe have a few case studies where we talk about different individuals and circumstances in their life and how these principles that we discussed over this past hour can be applied. So in the next part of this session, what we're going to focus on is 3 case studies which will allow us to be able to review the concepts and principles that have been covered over the past hour.